start with this. There. The reason we came up with this topic is because if you are on the flute list, people are constantly asking questions about what do I do if I have surgery as far as playing the flute. And a lot of y'all are younger, so some of this hopefully will never apply to you, but regardless, you still need to know about it, okay? So these are some of the surgeries that people have that they have questions about. A C-section, which is what people have when they have a baby. Hysterectomy, DNC, tubal ligations. A BSO is where they remove the fallopian tubes and the ovaries. And then with the breast, you have lumpectomies and mastectomies. So what are some of the things that people ask, like what questions? They're like, when will I be able to play? How many gigs will I have to miss? How soon can I go back to work? Will it hurt anything if I play? And they have other things like, will it cause hernias if I play? What about the stitches? But for the most part, it's like, how soon can I play and when can I go back to work? Which is, I mean, I understand that. But then after you have the procedures, these are the questions that they tend to ask. Am I going to be addicted to pain medicine? Is it going to cause a hernia if I play? And how long do I have to leave the steri strips on? Because sometimes that's what they've got. They don't have stitches or they don't have staples. They just put these pieces of tape that have very strong adhesive. When can I play? Do I need to cancel gigs? What am I going to do about the gas? Because you're going to have gas. And that makes it playing hard. Why can't I poop? Because that's also a problem with playing an instrument. I need to pee a lot. Is that normal? And I don't know where all these dots come from. You'll just have they're just on there occasionally. Is it going to hurt anything if I play? Is there a medicine I can take for the hot flashes? If you've never had a hot flash, you don't understand. But when you do have a hot flash, it's all-consuming and debilitating. And it lasts long, but it's pretty bad. How long am I going to be tired? All I want to do is cry. What am I supposed to do about that? And why is it happening? When can I drive? What do I do with the baby? I need to practice. I'm bleeding. Is that normal? I'm swelling. What do I do about that? And I'm having tingling in my fingers and feet. So the questions are very different after surgery, obviously. And of course, I wouldn't expect people to know before that they would need to know that. Some of what you're going to have questions about is going to vary after you have a procedure, because it's going to depend on which procedure you have. Obviously, if it's breast, some of the things are going to not apply, right? And the important thing you need to remember is that each case is individual, and you know, I may have breast cancer, you may, and you may, but it's going to be 4 different cases because there's going to be individual components to everything, right? One thing you will find out is that while healthcare professionals are very knowledgeable about medical stuff, unless they play an instrument, they don't understand. And I don't know if you've encountered this yet, but they don't get it. I mean, when you blow like that, it's not how we play a flute, right? So they don't necessarily get it. So that's one of the reasons we're having this. And while I have a doctorate in flute, I'm also a nurse practitioner, and I'm board certified in women's health, which is why I'm standing here telling you all this. So I do understand, because I've done both sides of it. So when you have a surgery, and this is any surgery, the more you move, and Angela's probably going to tell you this too, the more you move, the faster it's going to get better. If you go do some type of activity, say you decide to go pick strawberries when strawberries are out, and this is not something you normally do, then those muscles that you used are going to be sore, right? It's sort of the same thing, except it's obviously more extensive with the surgery. So the more you move, the faster it's going to get better. If you have any type of abdominal surgery, you're going to have gas pains. These are not like, I ate a lot of beans at Mexican, you know, and I've got gas. This is like major gas. And sometimes it's actually up in your shoulder that you feel it. And and it's a very sharp pain. Some people almost think they're having a heart attack. So when you've got an abdomen that is rock hard from gas, and it's not going away, you obviously are not going to be able to play the flute very well, right? And you know, after you have surgery, you have to remember that during a surgery, or even just a pregnancy, when you're having the baby, your bowels take a rest during the procedure. So your GI tract, when you go into labor, sort of shuts down, because that's not the part of your body that's the most important at that point, right? So when you get through and you wake up and you're like, oh, I'm hungry, don't go to Crystal. Don't go to Greasy Mexican. You're really going to regret it, I can promise you. You need to make sure you're going to drink a lot of water, because that's going to help. And you need to get out of bed, because getting out of bed is going to help move the gas out. And as my grandmother said, there's more room out than there is in, so let her rip, okay? Another thing, after a surgery, and this is any surgery, you need to get up and move because you don't want to get a blood clot. Anytime you have anesthesia, you're more prone to having blood clots.
Mm-hmm.
They're going to tell you don't pick up anything heavier than 5 to 10 pounds, which if you just had a baby, then hopefully your baby's not much more than that. You'll feel it if it was for a long time. Which flute obviously isn't. And they tell you not to drive for 2 weeks. Now, I'm not stupid enough to think that my patients did not get in a car and drive, but you need to be really careful about it. Don't be afraid to take your pain medicine. If you've had major abdominal surgery, you're going to hurt. And this applies to men too, because some of the things I talk about are the same procedures they use on men, since I see there's a couple in here, which your wife's probably broken in here, but that's okay. Don't be afraid to take it. You're not going to get addicted to pain medicine in an immediate post-op period, okay? When you have the surgery, and you may know this or you may not, they're going to put a catheter in your bladder. And they put this catheter in your bladder so that the bladder is decompressed, because they don't want to puncture it. And so anytime you have a catheter, you're having the risk of getting an infection, which is not an uncommon thing. So after surgery, you may feel bad, it may hurt or burn when you go to the bathroom, and you may have a fever. And if that happens, then you need to make sure you let them know so you can get treated, because you're not going to feel good. Most of you may have experienced bladder infections just on your own. It's a whole lot worse after a catheter. So, when you have a baby, obviously there's more than one way to have a baby, and you know there are a lot of reasons that women have surgical deliveries today. And why they have a surgical delivery can be different for everybody, but how they do it really isn't. There's going to be 3 types of incisions that they do with a cesarean section. That's what CS is cesarean section. I got time to write it. So all of these are going to involve going through the skin layers, the adipose layers, which is fat, and then the muscles. And then the uterus itself is nothing but a big muscle. So anytime you're cutting through the muscles especially, you're going to be sore and have pain after. So these are the 3 basic incisions that you have. The lower one, and then the lower vertical, and then the classical incision. And you have to realize also that what you have on the outside may not be what you have on the inside, but all of those are going to go through muscle, okay? So these are going to be uncomfortable. So after you play, after you have a baby, how soon can you play? And the simple answer is you can do it as soon as you feel like it, but there's some other things that you're going to need to think about. Well, number one, you're not going to give yourself a hernia from blowing. Have any of y'all ever had surgery? If you've had surgery, the respiratory therapy department came in and they gave you this little torture device. And I couldn't find mine, but it's this little plastic thing, and it has like a little ball with like numbers on it, and then it has a corrugated tube you put in your mouth, and they'll say, you need to do this X number of times a day up to here, and then they say, do it. And then after you try to blow your brains out and still not get anywhere close, they're like, well, that's not good enough, keep trying. And they're telling you to do this because they don't want your lungs to collapse, because this is a very common thing that happens after surgery. If this happens, you aren't going to be able to play. So they're going to give you the torture device and tell you to use it. And the way that you blow into the torture device is the way that we basically would play the flute and support our sound. So it's a whole lot more fun to play your flute, right? So I would tell you to play the flute. You're not going to feel like doing it necessarily. I mean, especially like 2 or 3 days later, but it's basically the same principle. But it does serve a purpose. You're gonna be sore. So other than the soreness, you have to realize that the inside is sore too. So the outside's really not gonna hurt near as bad as what's been done on the inside. You have to realize, that you've been growing a baby that's the size of a watermelon that has shot out of there. So not only do the normal pregnancy things have to happen, which it has to go back to normal, you've got the incision also. And another thing as far as playing is concerned, is you've got a baby. You've got to take care of that baby. And a lot of people have this vision in their head of they're sitting in their music room and they're playing the flute and the baby's in this little basket next to them and loving every minute of it. And guess what? That doesn't really happen a lot. They don't really like high noises. So every time you get, especially into the third register, you're going to hear, because it's hurting their ears. So, you've got to figure out what am I going to do with the baby while I am practicing. So you may have, and it doesn't necessarily help to put them in the next room because they still can hear when you hit those notes. And it may freak you out, that it's going to be okay. You just have to sort of figure out what you're going to do about it. And some kids don't care. And of course, if you played a lot while you were pregnant, and if you played music, you can put earphones on either side of your abdomen and play music to the baby. And if you play calming music, then that music typically will keep the baby calm or calm the baby down when it's on the outside too, if it's used to listening to it. I mean, I don't think I would play, Metallica or Iron Maiden for them, but it's up to you. It's your baby. I might try Mozart. What?
Oh, there are.
Well, I'm talking about the actual thing. You're correct, there are. Yes, and there's
Death
also
metal
Mozart
lullabies.
ones that are great too. But don't really have Ozzy Osbourne on there screaming Iron Man. And another problem you're gonna have after having a baby in any surgery, but after a baby is fatigue, you're gonna be really tired. Huh?
The rest of your life.
That's correct.
The rest of your life.
They don't go away at 18. So, you're going to be tired. You're having to, the baby's up and down all night, and if you're breastfeeding, it's going to be even worse, because some babies want to feed every 2 hours. So in other words, you feed it, and about the time you get it back to sleep, it's ready to eat again. So you're going to have to take into account as far as how soon can I start doing a gig. You have to take that into account. You are going to be tired. And I'm not saying don't breastfeed because I'm a strong advocate for breastfeeding. That's why God gave us boobies. It's good for you. It helps you get back into shape quicker, but it's also going to keep you up more. And, there's no superhero award for being a woman, but there really should be, because I can promise you that you're going to be doing most of it. The husbands tend to sleep. If you're breastfeeding, you have to do it. They can't do that for you. And even the man is nodding his head. So remember, your muscles have been sliced open. You're going to be sore. Advil, Aleve, Tylenol, things like that actually work really well for this type of pain. They're not going to give you a lot of pain medicine in this day and age. Like narcotic pain medicine. So you can take that. Unless there's a specific reason you know of, you can take it, and it's going to really help you quite a bit. And I did this really late at night, so sometimes I repeated myself, sorry. But you need to remember, if you've had a surgery like a C-section, while everything's getting back to normal, you're going to be very sore. And I would not schedule a big orchestral gig in the first week after I've had a C-section. You're not going to be able to do it. female surgeries. And, you know, I hope none of you ever have to experience this, but if you do, you'll know a little bit more about it. Just some of the female surgeries are hysterectomy, where they remove the uterus. They can remove just the uterus, they can remove part of the uterus, and they can remove the tubes and the ovaries with it. It sort of depends on why they're doing it, what they remove. You can have fibroid tumors, and these are just benign tumors that some women get. They make the uterus grow. They can be uncomfortable, but one of the big problems with them is they make you bleed. And so, you know, it doesn't take too much bleeding before women are like, enough, fix this, stop it. You can have ovarian cysts. Then with your breast, you can have mastectomies, which is removal of the breast, or you can have a lumpectomy, which is just the actual lump and a little bit of the area around it. You can also have bladder surgery. So these surgeries are done for different reasons, but they're basically all going to be the same types of things you have with cancer. So I'm going to talk about cancer because some of the things that she's going to talk about relate to problems from the cancer that are really big problems with blue flame. So all of these cancer diagnoses that you can have in women are going to have different treatments. As far as the surgeries, the main surgery they're going to do is a hysterectomy because it's going to be curative, especially in the early stages, for pretty much everything. But they may not do this first, so I mean, it's going to just depend on what you've got. If you have personal questions, I can answer that. But there are different incisions they can use for the hysterectomy. You can have an open abdominal surgery. You can have vaginal. If you've had 10 babies in your uterus, it's probably really easy to do a vaginal hysterectomy because it's kind of hanging out lower than it's supposed to be anyway. So you just kind of pull it on out and snip, right? You can have laparoscopic, and you can have robotic. And actually, a lot of times the type of incision or how they do it, it's not your decision, unfortunately. Usually they don't let you decide. It's going to depend on the skill of the surgeon. And you have some surgeons that are excellent, they're brilliant, but they don't do maybe robotics, so that you don't really have a choice. You sort of have to have it done with an open incision. And if the cancer, if they think it's more advanced, and if you have a cancer, you're going to have imaging tests like a MRI, CAT scan, PET scan, things like that, where they can sort of determine probably what stage it is. They don't know for sure until they actually get in there, but if they think they're going to have to go in there and, like, say if they want to debulk you, which means they go in and remove as much of the cancer as they can, which is going to give you a much better survival rate, they're going to have to do that with an open incision because they can see better. These are the types of incisions you have with an open incision. They can go horizontal, just like they would when you have a baby, or you can do vertical, except usually when you have the vertical, it's like around the belly button and down, so it's a big incision. And it's not always, well, it's never pretty. My aunt had ovarian cancer and had a big incision, and she told the doctor that he needed to learn to draw straight lines, and his response was, "You got a crooked abdomen." Wow. She didn't find very humorous at that point. But today, the standard of care is actually doing it robotic, and this is about as minimally invasive as we can do at this point. What they do is they go in with like something like a big straw, kind of, and they puncture different areas of your abdomen, and then they stick these little trocars in there and have got arms and cameras, and the surgeon sits like away at a console and does all of the surgery through that and lets the arms do it. They put you on a table and tilt you with your head going down, and then they inflate your abdomen with usually carbon dioxide so that everything is blown up so they can see it. And it takes a little bit longer, but for you, it's a whole lot easier because you don't have those big incisions on your abdomen that have to heal. These don't even require any type of sutures or stitches. Usually, you know, that stuff that they paint on there to put things, to hold things together, usually they can just put some of that on there and that's all you need, which that's a good thing. And that's an example of where they would make these little incisions, and laparoscopic is gonna be sort of similar. So, you know, that's a whole lot better than having your entire abdomen open, right? One of the nice things about this, other than you have less pain, is that you go home usually in 1 to 2 days. Some people get it done early in the morning and go home that night if they don't have any complications during the surgery. And I don't know about you, but I have found that most people, including myself, sleep better in my own bed, right? But one of the problems with this surgery is that people think they can go back to their normal activity sooner. You have to remember, if you have a robotic or a laparoscopic surgery, your insides still have major abdominal surgery, okay? So you still have to heal. If you get the gas in your stomach, which you will with this type of surgery, you have no idea of the type of misery you can have until you get rid of this, okay? You cannot play with this in there. Even though you are not open on the outside, when you as far as like supporting your stay on, you're not going to be able to, at least not initially. Constipation is also going to be a huge problem. Some people clean the bowel out before a surgery and they tell you to do like clear liquids and enemas and all of this. Actually, a lot of the most current research says that that's the wrong thing to do, which I agree with, because if you've done that, unless it's a bowel surgery, then you might need to, but if you empty your bowel out, it's going to be that much harder to poop after. But if you've had salads, light food, stuff like that, which is got fiber, then it's going to be easier to poop. And sometimes they don't want you to leave until you go to the bathroom. Pain medicines, they slow down the GI tract also. I still think you need to take them if you need them, but you just need to realize that narcotics make the bowels go to sleep too. So, the breast issues. And all of this applies to men too, because men can get breast cancer, which I don't know if y'all know that, but they can. So the breast can develop cysts or tumors. These can be benign or they can be malignant. And usually if you have some type of lump, they're going to do imaging studies and then they're going to want to remove the lump. They may biopsy it to see what type of surgery they need to do, but they want it out. And you do too. Smaller lumps can be done very simply. Sometimes if they think you've got cancer, they're going to want to have it more extensively. As far as what type of surgery you end up having, or what types of incision, I mean, there's a whole, I mean, it's like a clock, so it could be anywhere or in this area where they do the incision. It's going to depend on where the lump is. They can do simple removal of the lump up to removal of the entire breast and all of the surrounding tissue. It just depends. Today, a lot of times they're going to do breast conserving surgery, where they just remove the lump or just remove a part or a segment of the breast. You know, the traditional mastectomy is what they used to do, and many of y'all are young and you don't remember when Nancy Reagan was first lady, but she got breast cancer, and she opted to have a traditional mastectomy, and she was really, I mean, she caught a lot of flack for that, but that was her decision. She's like, I want to have it gone, and I don't want to have to worry about it ever, so I don't need it, take it away. And some people are like that, but some people want to keep their breast. And that sometimes is going to be your decision. Sometimes when people have everything removed, they also have reconstructive surgery done right there on the table, and that's going to be a huge long surgery. Sometimes it's 8 to 9 hours. And of course, if you do that, your recovery time is going to be slower. When they do breast surgery, they're always, and they do this with abdominal surgery too, they're going to remove something called a sentinel node. And a sentinel node is going to be one of the lymph nodes that is closest to where the tumor is that you would expect the organ and the tumor to drain into. And they want to see if the cancer has spread. And I don't know how much you know about cancer. Hopefully you don't really know much about it. I don't want you to ever experience it. But we all have abnormal cells circulating in our body constantly. And there's some type of stressor that then sort of, I guess you could say, activates these cells. So the more active cancer cells you have circulating in your body, the bigger chance you've got of developing another tumor or metastasis, in another area. So the lymph nodes are, they're all over our body, and they're basically the body's drainage system. They're just like our sewer, and they drain things out, away and out. And so when they take these sentinel nodes, and sometimes they'll take 20 nodes, then this is like putting a dam into a river, and it stops the flow. And when it stops the flow, you're going to have a big problem, because, and especially like for a flute player, if you have, if you get this where they've got the nodes removed and stop the flow, you start getting swelling above and below where that was. And if your right arm is the side the breast cancer was on, and they've taken nodes, and your right arm swells up 2 to 3 times its normal size, you can't really play, right? So it's called lymphedema, and it can be quite disabling. They do have things they can do for it. This is about, they do it in the uterus also. So it can happen in the arms and the legs typically. I think I told you most of this. This is a picture of like the lymphatic system, and then that's like the breast. And you can see where they're taking the nodes away. And they're taking the nodes at the very top of the arm. So that means that all the fluid that gets into this arm, there's not a drainage system necessarily to get it out, right? So the arm swells. And she's going to talk to you more about that. I'm just sort of telling you about it. But it does happen in the legs after a hysterectomy. It can. So if you get a cancer diagnosis, a lot of times, like I said, with the uterine and that type of stuff, if you do a hysterectomy, if it's caught early, that can be curative. But a lot of times they want to do chemo and or radiation. And most people think if they get chemo, the first thing out of their mouth is, am I gonna lose my hair? The chances are good that yes, you will, but you know what, hair grows back. It's far from the only complication, but it's just not one of the worst ones. It does have a self-esteem thing for a little while, but it doesn't, like I said, it'll grow back typically. One of the biggest problems that's gonna happen with chemo is neuropathies. And when you get a neuropathy, that's when the nerves that supply the peripheral, not in the body, but in the peripheral, which is your legs and your hands, are going to be damaged. And so you can have, like when your hands go to sleep or your feet go to sleep, you have that type of thing where you can have warmth or burning. You can be crampy. You can't, like if you touch the stove, you wouldn't be able to tell it was hot if it was on. So if this happens in your hands, are you going to be able to feel the fluid? Are you going to be able to feel how hard? You can't tell how hard you're pressing, what you're pressing, nothing. So, and then if you got it in your feet, my aunt got this. She had trouble walking because the bottoms of her feet hurt so bad, and she couldn't tell when she put her foot down. So you can imagine you can't stand and give a recital, right? It doesn't happen with every chemotherapy. There are certain ones. I think it just happens more with the ones that might have like platinum type things in them, or that end with platinum. There are medicines that'll help. They give you antidepressants or steroids, seizure medicines. We use those a lot for pain, and pain medicines, and hopefully it's going to go away. But a lot of times this doesn't go away. I mean, you still have in the tips of your fingers some numbness and tingling. Another big problem is going to be bone pain, and this is going to prohibit you being able to play the flute too, right? It can be quite debilitating. This pain really responds well to the non-steroidal anti-inflammatories and actually Claritin, what you take for your allergies. I should have here because I'm like constantly draining. But that really helps with bone pain. You also can get really bad mouth sores. Have any ever had ulcers, or if you get like fever blisters? Imagine if your entire mouth and throat are full of those. You're not going to be able to play. So if you're going to get chemo, you sort of need to see what type of side effects it might have, because you would not want to like do your graduate recital in the middle of chemo. Which you can rinse your mouth with salt water, and that will help and avoid spicy foods. But from my experience, if it's a chemo that tends to have it, they're going to have it no matter what you do. And one of the things that people always overlook, and it happens with surgery, and say you have a baby, that's sort of a self-limited thing, right? And yes, you're tired after the baby, but you do get better. But when you get cancer, one of the main signs of having a cancer is fatigue. This is not like I've stayed up over the weekend partying and having a good time, and I'm really tired on Sunday, so I'm going to sleep longer than usual. It's not that type of, this is like just a bone-weary fatigue that is constantly there. You could sleep 15, 16 hours, you wake up and you go to the couch and you just go back to sleep, you're just so tired. It's worse before and during treatment, but even after treatment, even years after treatment, your stamina level is different, and your fatigue is, some of it can still be there. So, you know, you sort of need to plan for it. You need to make sure you get enough sleep, and you can plan for naps. But, you know, if you need to sleep, you need to do it. Oh, I'm sorry. I'm going too far, too long. I'm almost done. Another thing you don't need to overlook is the mental health aspect. And anytime we have a baby, we're a mess of hormones. They have to settle down, and you can get postpartum depression and just get the down in the dumps blues. But anytime you have a female surgery, whether it's breast or lower, I have found that people tend to have trouble sometimes with this, because basically we've been castrated. I mean, when you get your ovaries out, you're castrated. You are put into menopause. If it's for surgery for cancer, they will not let you have hormones. And, you know, you're a mess. And some people really have trouble with the change in their body image. So it happens with the breast and below. You need to make sure that you address this. You know, some of y'all are young. Imagine if you were told you got cancer and we've got to take everything out and you're never going to have a child. And that's the thing you want more than anything. This is a devastating diagnosis. And it's going to be really difficult to keep your, you know, levels up. And, you know, then when you have people that's like, oh, you have good cancer, you know, that's, you know, your uterus is gone, you should be fine. And they just totally overlook the fact that it's your body and part of it's gone. And, you know, there are things that happen when you have a hysterectomy. You know, the bowels fall, you don't cook as well, you pee constantly. I mean, there's just a whole lot to it. And some people, they don't care, and if you do a happy dance, then that's okay too. But you need to be aware that this can happen. That's the end of my parts. You have enough time, right?
Mm-hmm.
You don't need this. Okay.
Morning, y'all. How you guys doing? So I'm going to be talking. Do I need this? Do I need this? Okay. I'll do my best. I'm not very good at standing still. Okay. So I think everybody got a handout? Yeah? Okay, so what I'm going to be talking to you guys more about is more about cancer and exercise and things that if you had cancer, or if you had surgery. I had my gallbladder taken out in January. Has anybody ever had this surgery? It's good. I don't recommend it, but I mean, I tried to get away from it for about a year and finally just went with it. I can tell you that the thing I was not prepared for, as she mentioned, was the gas pain. And you're like, oh, it's gas, ha ha ha. No, oh gosh, no, like your stomach's way out to here and it's trapped. It's like it can't escape because they closed it up and it is stuck. And my cat actually went missing the day before, so it's probably the best thing because I just walked around the neighborhood looking for him. He still hasn't come home, by the way. But anyway, I went looking for him all around the neighborhood, and that was the best thing to get the gas out. Sitting there was just like somebody was stabbing me in the shoulder. It's terrible. So anyway, just be aware that if you ever had any kind of abdominal surgery, Move, please move. Don't just sit there and be like, oh, I hurt. No, please move, you'll feel better after you sleep. Okay, so I'm going to be talking to you cancer in the flu. One of the big things when it comes to cancer, breast cancer. So when it comes to that, exercise is actually really good for you. There's a study that physical activity reduced breast cancer risk, and just 75 minutes, 2.5 hours brisk walking per week can reduce a woman's risk by 18%. That's not really bad, right? So we've got a couple of different things, different treatments. We've got lumpectomies and auxiliary node dissections, the thing that she talked about when you take the lymph nodes. Things that you've got, side effects, the lymphedema, the swelling. Really don't want that. If you're given a sleeve, sometimes they'll give you a sleeve. Please wear it. People don't want to wear it. They don't like it. It's kind of ugly. You don't want swelling. And I've got some pictures here. This book, if you want to take a look at it, I highly recommend it because you will see what the swelling looks like and all the different types of surgery. We're going to be doing a Q&A at 1 o'clock down in the Performance Health Committee booth, and I will have these here. You can look through them and get way more information. But we've got the potential side effects for lymphedema and adhesions. So does anybody know what adhesions are? Those things stick together. You think about it. If you've got breast cancer and they did any kind of surgery, you think you're going to be moving in the same way that you did before? No, right? So we play flute like this, right? We don't ever play like this. So between front and back and left side and right side, we're going to have some kind of muscle compensations, right? And it's just something to keep aware of. So if you're not exercising before, it's definitely a good situation to start exercising after. And there are some guidelines in here, aim for 3 to 4 times a week, 20, 30 minutes. So it's better for you to exercise than to not exercise. Let's see. So we've also got things with like breast reconstruction. We've got capsular contractions, that you can read all those. There are different types of reconstructive surgeries. So with all of those, taking those into account, just think about it. We're used to playing one way. We're used to having muscle mass. We're used to having breast tissue. We're used to having all these things right here. And if they're gone, that's going to change how you feel, how you pick it up, how you play it, how you move. There's now also an imbalance between front and back because your body's used to doing something. So keeping stretching on that front side, keep strengthening on the back side, but also still moving. That's really, really important. You can have weakness and instability in the shoulder girdle too. It's not just about your chest. Several of these surgeries, they reconstruct your breast tissue from other parts of your body. If they can take it from your butt, they can take it from your lats. If they do that, that is definitely going to impact how you move because suddenly those muscles are gone. So if you know anybody who has that, it's kind of it's a good thing to know. There's also muscle wasting that can happen, right? Especially if you have chemo. So you want to keep your exercise at a low to moderate intensity to maximize the decomposition of body fat and minimize the production of lactic acid, but you don't want to just not exercise. Another thing, if you have chemo, you know anybody who's had chemo? Chemo brain is a real thing. We've had brain fog before. You don't know what to say. You don't remember things. It's a real thing. So it can cause that fatigue of your brain and that, what am I talking about? So be patient. If it's you or if it's somebody that you know, be patient with them. And like she said, fatigue, oh my gosh. So when I got my gallbladder out in January, there were things I didn't even think about when it came to fatigue. I thought, well, give me a week, I'll be back in the gym training people. I was, but it wasn't pretty. It's like, well, they're the ones picking up the heavy weights, I just gotta tell you what to do. Yeah, that's not really how that went, but I did it, I don't recommend it. Same thing with the driving. I got in my car, drive around with my kitty. You gotta be real careful because you got internal sutures. I didn't think about that. Oops. So move, be careful how you move. But the fatigue, it's crazy. You don't realize how tired you're gonna be. And we're not talking like sleepy tired, you are just weary, right? I thought, cool, I'm gonna have a whole week, maybe 2 weeks off to have the surgery. I'm gonna get so much work done. You cannot focus. It was me and movies. Because I was like, I got work to do, and my brain's like, no you don't. So it didn't happen. So just be prepared for that, especially whether it's you or somebody you know, right? Again, with the heavy lifting, I love to pick up heavy things. It brings me joy. Don't do it after you've had surgery. Pick up other things, small things. Keep moving, don't pick up the heavy things. Just wait, and you'll figure it out. So there was one day I'm in the gym. I'm trying to demonstrate to one of my clients bench press movement. oops, I forgot that bending backwards, it's weird because, you know, whether you have surgery in this area, if you try to bend backwards, things can pull. And you have to wait a while to regain that sense of flexibility that you used to have. Let's see, there's one other thing that I didn't put in the handout is about thyroid cancer. So you might have a radioactive iodine therapy. There's some potential side effects that have to do with your mouth. You can get pain and swelling and tenderness in the neck and salivary glands. We already know how this is going to affect you, right, with your breathing. You can also get dry mouth. It can reduce your tear production, so you get dry eyes. Not something you generally think about when you go to play and you can't stop blinking and it just hurts. In dry mouth, you guys ever had an audition, you have dry mouth? It's not a fun situation. And constipation too, yeah. Headache, nausea, vomiting, all that kind of stuff. You don't think about it until it's time to play, and if you're dealing with that and you've scheduled any kind of playing situation, it's something to take into consideration. So I think we have a few minutes to take some questions if anybody has any questions or thoughts. Yes, ma'am.
Do you feel like yoga is a good exercise, or are you talking about calisthenics?
I think either or, it just kind of depends. She said yoga or calisthenics be better. I think it depends on your specific situation. Because yoga is moving, but.
You have something inside, you don't need to do, you're not gonna be able to do jumping and calisthenic type stuff.
Yeah.
Because if you remember, the insides had major abdominal surgery.
Yeah, I was thinking more as like the prevention part of it.
Oh, for prevention or.
Exercise period.
Okay.
Oh, say one more time.
Well, you're saying it lowers the risk of cancer by 18%.
That was generally considered more calisthenics than yoga, but I bet that would factor in for sure. For sure. Yeah, does anybody else have any questions about anything? Wonderful. So I think that's it. We're going to end a little early, but thank you guys so much for coming. We really appreciate it.